So we'll go ahead and start. Well, I apologize for all the technical difficulties. Thanks for joining us this afternoon. My name is Jim Crittenden. I'm the Alcohol, Tobacco, and Other Drug Coordinator for the San Diego County Office of Education, and I'm pleased to moderate this session with Karen Lenyoun from NAMI, and April Ella from A New Path. We'll be sharing a lot of information today about fentanyl, what fentanyl is, how to detect overdose, some data, and also for how to obtain naloxone, especially if you're in a school setting. A few different ways or a couple different ways that we can go about getting naloxone in schools. The Zoom chat is disabled. Any questions that you want answered, please put in through the main conference platform, the FeedLoop platform. Please use that chat function. I'll be monitoring that. Our other speakers won't be able to see that either. They won't have access, but we will have time for Q&A, and I'll be monitoring that chat through FeedLoop as we go on. So with that, I believe I'm going to turn it over to Karen.
Great. Thank you so much, Jim. Well, good afternoon, everyone. I hope you're enjoying the Live Well Advance this year. We're all still adjusting to this remote world that we're living in. So here we go for year 2 doing this. So we should be experts by now, right? But there's always a few little glitches. So such is our virtual life. Thank you for your patience. So I wanted to talk to you today about opioid misuse awareness and what NAMI is doing before I turn it over to my colleague, April Ella from A New Path. So my name's Karen Lenyoun. As Jim mentioned, I work with NAMI. I am the program manager for the Elevate Youth Project. April will also be presenting in just a few minutes once I finish with my slides. And then I also have additional team members that are on the line today who help me with our presentations and some of the things that we're doing with peer mentoring. So here's a quick overview of where we're going. First, I'll talk to you a little bit about NAMI San Diego, what we do in case you've not heard of us, where we've been all these years, how long we've been around, a brief description of what Elevate Youth California is. Then I'll talk a little bit more about stigma. I know you heard that in the main session today. This is a little bit different take on it as it relates to substance misuse and mental health. And then we'll dive deep into the fentanyl crisis that we're experiencing nationwide. I'll talk a little bit about the options for obtaining fentanyl, what the resources are that NAMI has to offer, and then I'll turn it over to April to give you a hands-on presentation about naloxone and how to use it. So the mission of NAMI San Diego is to support, educate, and advocate. So we support people with mental illnesses and their families. We do that by helping them to find coping mechanisms, to find resources. We educate people who are struggling with mental health conditions, as well as their families and loved ones. And then finally, and maybe most importantly, we advocate. We advocate for more research. We advocate for better policies. And NAMI nationwide has done an enormous job in advocating for some of the laws that have happened recently and in the past that are more conducive to better mental health and co-occurring conditions, policies and procedures. So a little bit about the history of NAMI San Diego. We've been around since 1970, believe it or not. Started as a parent support group of parents who had children all with very serious mental illnesses. Most of their children were struggling with a diagnosis of schizophrenia, and they had absolutely no resources and no place to go. So they started their own support group, became a national organization in 1979. And then our helpline started in 1984. And I'm really proud to say that this year we've actually taken almost 6,000 calls on that helpline. So really tremendous resource in San Diego. There are 950 approximately affiliates of NAMI nationally. So we all operate as independent franchises, as you will, depending on who you talk to. NAMI San Diego is one of the 5 largest. We are the only affiliate that has the Children, Youth, and Family Liaison, however, which is another great resource for our youth. So I mentioned earlier that I manage a program called Elevate Youth California. So these are the objectives of that program. The very first one is to address those co-occurring conditions that I've referenced. in populations in the county, not only in San Diego County, but also Imperial County. We're moving to Imperial County this year, as a matter of fact, with mental health awareness, peer presentations. We do a lot with suicide prevention, mental health education. We talk a lot about harm reduction education, which is what naloxone and Narcan is. And then also we educate about medication-assisted treatment for opioid misuse. Additionally, we offer a prevention program that addresses student-youth connectedness, and it's called a youth leadership development. It's student self-leadership. You can actually view one of our videos. This is my shameless plug for the other program. It's located in the movie theater that the Advance has up, and we are video number 13, lucky number 13. So in case you want to view that after the session, that would be great. And then finally, we offer support to families, loved ones, and natural supports of youth that are participating in all of the above projects that I just mentioned. So a little bit about stigma as it relates to person-first language. And I almost say that we need a language audit for some of the things that we're doing in our prevention and treatment messaging. So I have some terms up on the screen that what I like to refer to as stigma busting recovery language. So we prefer to refer to the person as opposed to the disease, right? Because person-first language shows that the person has an issue rather than they are the issue. So we say something like they are living with paranoid schizophrenia instead of saying they're schizophrenic. Or we say that they've experienced several hospitalizations instead of saying something like they are frequent flyers. Or we say that they have a substance misuse condition as opposed to saying that they are an addict or an alcoholic. So I think you kind of see where I'm going with this. And I've got several examples up on the screen, that they had a positive or a negative drug test instead of saying that they are clean or dirty. So these are just more humanistic and less stigmatizing ways of addressing both mental health conditions as well as substance misuse conditions, because we know that the two main factors that affect the burden of stigma are whether the person is perceived as having control and whether it is their fault. And so when we take that out of the equation, we have a far better chance of someone actually getting treatment, because stigma really keeps people from seeking treatment and receiving treatment. So we talk, as I mentioned, quite a bit about this at NAMI. And I really, in every presentation that I do, I address this issue because it is so monumental and it has kept so many people from actually receiving help. And you'll see that in some of the data and the numbers that I have to show in just a little bit. So this news report came out and was from CNN when I first started doing these presentations with April back in the summer. And it was highlighting the drug overdose deaths that rose close to 30% at that point in time. So this was data from 2020. And at that time, Dr. Nora Volkow was saying that the highest number of overdose deaths ever recorded in the previous 12-month period had happened during that period of time. So they were looking at 2020 to 2019. And at that point, it was 72,000. Well, today, CNN posted another update on those numbers, and they actually are going in the wrong direction. So now, as of today, more than 100,000 people have died of drug overdoses in the United States. And we know that primarily those have been like 64%, so 2/3 have been caused as a result of fentanyl overdoses. So that's why we're here today, to talk about the overdose reversal life-saving drug, naloxone, and how to administer it, and to look at the gravity of the issue and the problem right now. So we know in that same period of time, COVID killed over 500,000 people. So, 20% of that number actually died from drug overdoses, primarily due to fentanyl. And as Nora Volkow said, this epidemic knows no geographical boundaries, and it continues to get worse. And so those were national numbers. Let's look a little bit at what's going on in San Diego County. San Diego County, the increase in fentanyl overdoses from 2019 to 2020 went from 152 to 458. And then looking at how we're trending towards the end of this year, we're already at 530 as of August. So we're looking at close to 1,000 deaths from fentanyl, just fentanyl overdoses, not any other drugs. So very serious problem. We really need to take some drastic measures and some really hardline harm reduction measures to address this issue. This graph just shows the month by month increase, and you can see the direct correlation from when COVID hit us in March of 2020 and just that tremendous spike in overdose deaths after that date. And there's a lot of reasons for that, because when COVID happened and people went into lockdown, they were removed from their treatment protocols. They weren't able to access treatment. The drug supply became tainted. There was disruption of the drug supply at the border, all kinds of reasons why that spike is that we see. So here's another reason why we're very concerned, is because of the age ranges here. So we see that this is hitting primarily young people between the ages of 20 and 39 is where the majority of the fentanyl overdose deaths were happening. But we also have some teens that have died from fentanyl overdoses. And so we're very concerned about that, which is why we're talking to the schools and why we're having fentanyl placed in every school site. So some of the reasons why we're seeing so much drug use and so much devastation with this is the treatment gap. So you can see that for substance use only, 89% of individuals struggling with this never receive any treatment. And if you look here at the co-occurring conditions, we have over 90% never receive any treatment for either their substance misuse condition or their co-occurring mental health condition. And then finally, looking where I have the arrow, you can see that the youth actually also are not receiving treatment in a very timely manner. So we have almost 57% of our youth ages 12 to 17 are not receiving any treatment at all. So then we talk about the average delay in treatment, and some of these numbers are a little bit dated because, as you know, the data lags behind. So some of this is from 2019, so it doesn't even include what's happened since COVID. So we know that there is an average of an 11-year delay between the onset of symptoms and when treatment actually occurs. So for a young person, say someone who is in middle school, that's pretty much their whole teenage life that they have gone without any treatment at all. And then we can see over on the right-hand side that we're not alone. We have many, many of us in this country that at some point in our lifetime experience a mental health crisis. And I would venture to say that this number is probably double what you're seeing on the screen, because as I said, these are pre-COVID numbers. And this slide just breaks it down by ethnicity, the prevalence of mental health among us. And over on the right-hand side, we can see the type of mental health issues that we see in our country. It's a little bit deceptive because it kind of looks like all of the anxiety conditions are over on the East Coast. This actually is just the way they've divided up the slide. So anxiety disorder seems to be the most prevalent mental health condition that people experience in our country. Understandably so, considering everything that we have going on. And then this slide shows the people who get treatment in a given year. So our youth, once again, because this is the school summit, I want to focus on the youth. So we know that only 51% ever receive treatment. And over on the right-hand side, we have the numbers broken down by ethnicity again, just so you can see kind of the cultural gap in receiving treatment. I've been saying that term co-occurring condition quite a bit, so let's address that for just a second here. And what co-occurring conditions are, the psychiatrists have a very complicated term for it. They call it psychiatric comorbidity. It used to be called dual diagnosis. It's basically the interaction between a substance misuse condition as well as a mental health condition occurring simultaneously. And who's affected? So we know that 7.7 million people in this country struggle with a co-occurring condition. And again, over on the right-hand side, you can see the treatment gaps. So this is color-coded. It makes it a little bit easier to read. So we can see that 52% receive, so this is the yellow, so the primary percentage of this pie graph, receive neither treatment for a mental health condition or their substance misuse condition. And we see that only 9% receive treatment for both. So we have a lot of work to do in terms of making access to treatment better. Again, here's just another way of saying it. We know that people with substance misuse conditions, just to drive home that point, 90% never enter treatment. So, and then what happens consequently is that they're 3 times more likely to visit the emergency department, 5 times more likely to be hospitalized. So even if you don't know anyone who struggles with a co-occurring condition, which is pretty hard to believe in this day and age, but let's just say for the sake of the illustration here, why should you be concerned about it? It's because of these numbers over on the right-hand side here, because we have individuals who are not getting treatment in the proper form and format, and so they end up in the ED, which is very problematic in terms of our medical industry and medical facilities and treatment that we have. So behavioral health strategy in San Diego County has integrated this naloxone distribution program as part of their integration and access strategy. This was done over the summer. So just to kind of show you the hierarchy for where that strategy is going. So healthcare integration and access, naloxone distribution is top of the list. They're going to assess community readiness for some of the other harm reduction measures that will be taken later in the year, or probably early next year now, one of which is the syringe service program. And then here is just the press release and the media event that happened announcing that. So we have a picture of our Live Well San Diego event. We have our supervisor and Dr. Bergman there also announcing that these new measures would be taken in the standing order. You're going to hear a little bit about this naloxone standing order in just a minute, but that would be county-wide. So that's what's giving us the ability to distribute naloxone. And then one other thing that I mentioned was the syringe service program, which you will probably hear more about next year, but it is also part of the harm reduction strategy because these strategies save lives. And so they have been proven. There's lots of data around them, lots of research about harm reduction in our country and actually internationally. So Jim talked a little bit at the beginning about another option. So unfortunately, I can't see who's here. I'm just talking to the white light on my computer screen. I'd love to be able to see all of your faces, but I imagine that we have quite a few members from our school district. And so some of the things that this program is good for. So if your district is smaller, if you're a charter school, if you are a youth serving organization and maybe are serving not a huge number of students, or if you can't devote a lot of your school staff time or other individual staff time to monitor a program for the standing order, then what you're going to want to do is contact either myself or April because we have that standing order. So that will bypass your need to go through the Department of Healthcare Services and obtain one yourself. So I'll give you my contact information so you can do that, and then we can arrange delivery for the naloxone kits to you. I never like to end a presentation without giving you some resources. So here's some great resources that we've compiled at NAMI. These are some general resources that deal with all kinds of mental health conditions, as well as co-occurring conditions. We have our 2 apps that are incredible, Oscar and Oscar Junior. They're available on any platform that you use, whether it's an iPhone, iOS, or an Android phone. You can just download them from your app store, and they are in many languages. And they give great resources. They even have some relaxing music to help you through whatever crisis you might be dealing with. So I highly, highly recommend them. The Oscar Junior app is for individuals under the age of 18, so specific resources for youth. And then finally, these are some of our NAMI signature programs. And I mentioned earlier that I identify as a family member. So I went to NAMI, a NAMI class called Family to Family, which is the NAMI signature program, about 13 years ago, because I have a family member that was really struggling with a co-occurring condition. And that Family to Family class changed our lives. It changed the trajectory in which we address the treatment and conditions for our loved one. And so I cannot speak more highly about that class. And I've become a strong advocate for NAMI ever since, and actually started working for them about 3 years ago. So I'm very excited to be here and to be able to share this information with you. You can check out some of our other programs on our website, which is namisandiego.org. I have a QR code here for a survey that we can do at the end. And when I turn this over to April, she also has the same QR code. So you'll be able to answer the questions a little bit easier after you see her presentation. So here is my contact information. I'll leave that up for just a second and then give the controls over to my colleague, April. So I'm going to stop the share. And April, you can take it away.
Awesome. Thanks, Karen. I appreciate all of the information that you always put into our presentations. That shares all of the information I would love to have in mind, but it's nice to make that switch and kind of change it up and not have one person just talking about it the whole entire time. So thank you so much, Karen. My name is April from A New Path, which stands for Parents for Addiction Treatment and Healing. I am the Director of Operations here, as well as the Program Manager for the Naloxone Distribution Project. So as Karen said, this is something that we have in place for people to start to sign up for their own naloxone distribution program, or to get Narcan in their schools, to the administrators, to staff, and then hopefully to students. We've been trying to push it to students for a while now. So this is kind of the process you would take. And I'm going to show you the presentation as it is for the training. So you kind of get an idea of what would be in that training, so that you could see what it would be like to give it to your staff members, or even if it was to an after school program to the students, or whoever you'd want to share it with and get this training. It's very vital information. So I will go ahead and share my screen. One moment. Of course, as soon as I do this, it's telling me it doesn't want me to share my screen. One second. I'll just do it this way.
I have your presentation as well, April, so I can share it.
For some reason, it's blocking me from doing it. So I'm trying to set it up, and I'm saying that it's yes, I'd like for it to do so. And of course, sorry for the technical difficulties again. 1 second. I might have to have you bring it up, Karen, and as I read, I guess I'll
okay.
have you
I will.
you know how this goes.
Right, exactly. So let me do that for you.
Go ahead.
Bring this up. Sorry, folks. Such is our virtual life. Here we go. Can you see it?
I cannot. Oh no. Okay, so this isn't working the way we want it to right now. So 1 second. You can share all panelists. I hit share. Okay, so yeah, I don't know why it's not working.
Okay. Let me try it one more time just to let's see. Oops.
Oh, there we go, Karen. I see it on. Oh, it went away.
Okay, hold on. There we go. How about now?
Yes, I can see it. Perfect. All right. So Karen will be controlling this for me.
There we go.
Karen, I really appreciate that. So this is our opioid overdose prevention and response training program for A New Path. Go ahead and click over, Karen. Thank you. So just a little bit more information about PATH. We are a nonprofit advocacy organization of parents, concerned citizens, individuals in recovery, healthcare professionals, community leaders, and our mission is to reduce the stigma associated with addictive illness through education and compassionate support, and to advocate for therapeutic rather than punitive drug policies. Just like Karen explained with NAMI, we started as a parent support group as well for parents of children with substance use disorders, and they got together together and realized that they weren't getting the resources that they needed to get help their children reach recovery. So that's how PATH was started in 1999, and we strive to ensure access to quality, cost-effective addiction treatment services, lessen harms associated with addictive illness, reduce recidivism, and save lives. This is part of our Ask Mom How to Save a Life project, which is part of A New Path's Moms United to End the War on Drugs campaign. We are in 35 states and 5 countries where parents just like us are handing out Narcan or clean syringes, in lieu of harm reduction to try and save these lives that need to reach recovery. A New Path testified in 2014 in California to help pass the Naloxone Access Bill and to allow organizations like ours to provide naloxone distribution under a standing order from a licensed physician, which has now opened up to basically anyone who would like to carry Narcan in their facilities. And that's why we are reaching out to you to put it out into the schools. A New Path provides free group and individual trainings for naloxone in San Diego County. So whoever needs to take this, they can get it for free, as well as free Narcan kits, or how to learn how to become a distribution project themselves. Next slide, Karen. Thank you so much. So since 2014, just to give you a little bit of information how our program's been doing since we started, we've trained over 8,500 individuals how to recognize and respond to an opioid-related overdose and how to administer Narcan. And since Karen's sharing one of my older presentations, we now have 2,062 reported overdose reversals from the use of Narcan during an accidental overdose. And some of these do have to do with the youth. We get calls from parents that tell us that they took our training, whether it was online or Zoom or in person, and they used the Narcan that we gave them to save their child's life. So this isn't just for adults, this also qualifies for youth, and they can use it even if it was a child that accidentally took some pills maybe out of the medicine cabinet. Even if they were under 18, you can use Narcan on them. Next slide. So training program details, you'll learn about the California law, which is the Good Samaritan law, which allows anyone at risk for having or witnessing an overdose to obtain a prescription for Narcan. The standing order prescription, which we will go over, that usually authorizes A New Path, but now, like I said, it's open to provide naloxone training to people who complete, or naloxone to people who complete our training. And we also provide, like I said, free group and individual trainings in San Diego County, and you will learn how to recognize and respond to an opioid overdose, how to administer Narcan, refill procedure, and anything else that you might need to help start your program. Karen already gave some of these stats, but just to kind of remind you, in San Diego County, that in 2019, 152 people died of a fentanyl-related overdose in 2019, and in 2020, it went to 457 fentanyl-related deaths in San Diego County. So we're trending in the wrong direction, and things like Narcan distribution will help us trend in the correct direction once we all start getting on board with it. So since the beginning of COVID-19, drug-related deaths grew 13% in the United States. It has not been that long for it to grow that drastically, so that's why we have to put this program in place and hope that you will join us and get yourselves trained and start up this program. So if you don't know anything about Narcan, it only works against opioids. It does not work for any other drugs. It only works for heroin, morphine, codeine, oxycodone, prescription painkillers like Vicodin or Percocet, and synthetic analogs of opioids like fentanyl and carfentanil. It doesn't work for meth, speed, cocaine. It doesn't work for alcohol. It only works for opioids. It doesn't work for benzodiazepines. So that would include things like Valium, Xanax, things like that. So it does not work against those. But even if you were to use Narcan on somebody who was mixing with benzodiazepines or alcohol with their opioids, it would not matter, because if they were not going through an opioid overdose, it is completely safe, it's non-addictive, and that this person won't go into further harm from using Narcan on them if it wasn't an opioid that they overdosed of, or if they even had a different medical emergency like a heart attack or a stroke. If it was something like that, it also wouldn't further harm them in their heart attack or stroke, and you would be going through a process of recovering that person anyways and calling emergency medical services, so that you'd still be able to take care of them even if it wasn't an overdose. So just to let you know, this is the kit that you would be receiving if you were to start taking the trainings, become a trainer and distribute as well. These are the Adapt Pharma Narcan nasal sprays. I think they changed their name to Bioemergent Solutions, but this is the kit that you would be getting. And this is the Narcan nasal spray. It's 4 milligrams, not the 8 milligrams, but it's a prescription medication that reverses an opioid overdose, and it cannot be used to get high. It's non-addictive. Naloxone is safe and effective. Paramedics and doctors have used it for decades. It's also called by the brand name Narcan. You will hear me and most likely most others say Narcan versus naloxone. But if you hear both names or if you hear one or the other, it does not matter. They are the same exact thing. Naloxone and Narcan are the same. It's an opioid antagonist, which means it blocks the drug from sitting on the receptor in the brain, while Narcan is sitting on the receptors in the brain. These are different naloxone formulations. So if you were to receive any other from a different organization, or if you went to a pharmacy, no matter what kind of Narcan that you receive, the procedure would stay the same, which I will go over the procedure in the next couple of slides, but you will be receiving the bottom left corner Adapt nasal spray. So, but if you got the intramuscular injection, the EpiPen version of Narcan, which is the top right corner, or if it was the drawback, like if you were in a medical facility, it usually probably would be the drawback with the vial and the syringe and needle. But if not, no matter which one you get, it will be the same procedure. What is an opioid overdose? So if someone's going through an opioid overdose, this is technically what it would look like in the brain. So the diagram shows you the brain, there are receptors in the brain, and then there are opioids that fit into those receptors. So when the opioid is in the system and in the brain, it has too many receptors for opioids. If you take too much of an opioid, it sits on those receptors, fitting perfectly and slowing and stopping the breathing. So the brain has many receptors for opioids. An overdose occurs when too much of any opioid, like heroin, OxyContin, Percocet, fentanyl, things like that, fits into too many receptors, and it doesn't remind the body or the person to breathe, so that they stop breathing, and this is how they start going into opioid overdose. And when you put Narcan into somebody, when you're trying to reverse an opioid overdose, what happens? So it's basically that same diagram, which shows you what it looks like in the brain. You have those receptors. The Narcan takes the drug off the brain temporarily. Everyone has to remember this. This isn't some long-acting drug where you give it to them, they reach recovery, and then they're fine and they never use again. This is a short-acting drug that buys you time between the time you call 911 and the time that the paramedics actually arrive for this person to be woken up and start to breathe again, so that they don't pass away. So Narcan has a stronger affinity to the opioid receptors than the opioids like heroin or Percocet. So it knocks the opioids off the receptors for a short period of time, and this allows the person to breathe again. So this is the first response to your opioid overdose. So just a little bit more about overdoses, just in case you aren't familiar with them. I know that there are a lot of school administrators that have come to us. They've never seen them. They don't know what to expect. So these are a couple of things that you might want to keep an eye out for, or just things that you should know. So ODs can be instantaneous or over a longer period of time. They can happen as a process. Someone could slowly stop breathing. They usually happen 1 to 3 hours after the drug was used if a person is actively using. So if someone's actively using, that could mean prescriptions, like if it was pill form, your doctor tells you to take 1 pill every 4 hours as needed for pain. Or if this was something with illicit drugs or counterfeit pills, if you were using and you were using consistently, say it was heroin and you're injecting 2 cc's every 4 to 6 hours as needed, as you say you think you need. And then maybe at the end of the day, whether it's prescription, illicit, or counterfeit pills, when you're at the end of the day, you think, you know what, I have nothing else to do anymore. I'm going to sit and watch some TV, but instead of 1 or 2 pills, I'm going to take 3, or I'm going to inject just a little bit more because I'm, done for the day and I'm going to relax. This person will slowly stop breathing because they have been using those receptors all day long, because they are active users. So it could happen a little bit longer after the last time they used, because they are used to taking that drug. So that's only with active users. If it's fentanyl or carfentanil, it can happen instantaneously. If you look at the image on the left-hand side, it shows you lethal doses of fentanyl and carfentanil relative to lethal doses of heroin. So you see the one that has heroin, it looks like there's 0.5 milligrams in there. You see carfentanil, which looks like it's just residue, like nothing looks like it even was in there. And then you move over to fentanyl, which maybe is like a pinch of salt sprinkles. Fentanyl is 50 to 100 times stronger than heroin. Carfentanil is 300 times stronger than heroin. So that's why we say it can happen instantaneously, because of how potent they are in comparison to regular drugs like heroin, or maybe a pill like Percocet. With new users, it can be instantaneous, and that's because if they've never used that drug before, their body has never had to atomize it, they've never had to digest it, and it doesn't know how to react. So if a new user has a reaction to it, that's another reason why it can be instantaneous. And then someone found dead with a needle in their arm is a rare event that's sensationalized. You might not ever see anything like that, but you probably won't run into anything like that. But it's not that that's something you're going to see every time you see someone overdosing. We have movies like Pulp Fiction, or like movies about, like musicians that you see with their needle still in their arm and things like that. But that's a very, very rare event. So fentanyl safety tips. Karen was talking about the surge of fentanyl that's coming into San Diego technically right now, in the United States in general, but San Diego has a very, very high rate of fentanyl that's coming in. So there's a lot of myths, if you want to put it that way, when it comes to fentanyl. There are some videos that show what happens when people run into fentanyl. There are lots of conversations about it, news stories that make it sound a lot scarier than it is. It is definitely a scary drug. It's definitely a potent drug, but you shouldn't avoid saving someone because you think you might be affected by overdosing of fentanyl like yourself, even before you try to rescue someone. So these are just some safety tips if you're going into an opioid overdose reversal, things you want to keep in mind to keep yourself safe if you know that you are coming into contact with fentanyl. So if you touch fentanyl, it can be removed from skin with soap and water. Just like the pandemic, it's best to use soap and warm water so you can bind with whatever you need to take off of the skin and rinse it down the drain, and you don't have to worry about it after that. Alcohol-based products such as hand sanitizer or wipes may increase fentanyl absorption, and that's not because it makes it go through your pores or anything like that, or opens up your pores and then you can get it through your pores or anything. It's more so because, just like the pandemic, if you use an alcohol-based product, you forget that you haven't washed your hands yet, you go off and maybe you eat something with your hands, you adjust your contact lens, it's ingestion. That is how you OD off fentanyl, not from it floating on the air, not from it just being on your skin and you not actually licking, sniffing, touching it, or getting it in your eye. You would not be overdosing off fentanyl unless it was ingested. So that's why we say, if it's alcohol-based products, if you did not have soap and water available for you to wash your hands at that moment, make sure as soon as you're able to, when the rescue is over, go wash your hands soon, but not necessarily immediately. And like I said, that's in terms of you saving someone who's not breathing. The person who is not breathing is more important than you knowing that you have fentanyl somewhere on your hands, arms, wherever it might be, and you can take care of it after you rescue this person. Powdered fentanyl does not penetrate the skin very easily, but avoid touching lips or eyes. There's no need for special gear or double gloving. One pair of nitrile gloves is enough if you have it. If not, no big deal. Follow the steps above. And then carry naloxone and be familiar with it for both your patient, your partners, students, staff, whatever it might be that you're catering to. So signs and symptoms of an opioid overdose. If you were going to go through and see an opioid overdose in front of you, there are signs of being really high versus signs of overdosing. People will ask me all the time, well, if someone's really high and they could overdose, can't I just inject them with Narcan while they're really high so they don't overdose? Theoretically, that does sound like a nice idea to prevent people from overdosing. But the hard part with that is that this is an opioid overdose reversal drug. If you give it to somebody who's really high, it just puts them into an immediate withdrawal. So they're still conscious. They're still conscious when you give them the Narcan, and now they're in withdrawal symptoms, which might make them aggravated. They are, not feeling well because of those symptoms of withdrawal. And now you have less doses of Narcan because you used it on somebody who was not actually overdosing. So the biggest thing I want everyone to take away with this portion of the training is that really high versus overdose, you inject them when they are not responsive. So that is the moment that you want to make sure that that's when you decide, do I do it now or do I do it, later? It's not that we want people to overdose, but like I said, if you have a limited supply of Narcan, you don't just have 10 boxes laying around. If you don't have that kind of quantity on you, the best practice is to wait. until an overdose happens. Then you can rescue that person. You have enough Narcan, you're calling emergency medical services, and you're able to address that. If they're really high, just make sure if it's in a school setting, you send them to the nurse's office. Let them know that they seem like they're dozing off, they have symptoms of being really high, and they could overdose. Maybe have them call their parents and have them monitor them to make sure that they don't overdose. So you want to just keep an eye on people who are really high, and overdose and unresponsive is when you want to inject them. So symptoms of being really high when you don't want to inject is muscles. They could be relaxed. They could have speech that is slow or slurred. They might not be making a lot of sense, but they are communicating. They could be sleepy looking, like with heavy and tired eyes. They could be nodding, so their head could kind of be, bouncing back and forth, but they pick back up and you're able to still communicate with them after their head comes back up. They could be responsive to stimulation like yelling or a sternum rub, so they are responsive. Once again, if they're overdosing, they're unresponsive, so they could have a deep snoring or gurgling. They call that the death rattle. A lot of parents, I like to let them know, or people that maybe know someone closely, if they've never snored before and all of a sudden they're snoring, that could be signs and symptoms of them using opioids. Very infrequent or no breathing, pale or clammy skin, heavy nod. So this is involuntary positioning. If somebody falls asleep, it looks like they're taking a nap in an awkward position, that could be because their body has given out. Not responsive to stimulation. So like, if you're yelling at them or asking them something or trying to wake them up by shaking them nicely, they're not responsive, that's overdose. And if you know how to check heartbeat or in pulse, you can do slow heartbeat or pulse, and that would be a symptom for you to see if that person's overdosing. A couple more symptoms to kind of keep an eye out for. Oh, sorry, if you could go back, Karen. Just to let you know, is the body could be limp, face is pale, pulse or heartbeat is slow, erratic, or not there at all. They could be throwing up or have thrown out, passed out, or are passing out. Choking sounds or gurgling, breathing is very slow, irregular, or has stopped. They could be awake but unable to respond. And then blue or ashy skin tinge, usually showing the lips and fingertips first. Karen, thank you. So if you've identified an overdose and you've seen enough to be worried, whether it's 1, 5, or all of the symptoms on the previous page of overdose, you want to check on them by tapping their foot, asking them if they're all right or okay, or saying something alarming. We don't want people to get in trouble. People don't naturally want to get in trouble. So if you're saying something like the teacher's coming, your mom is coming, a cop is coming, to try and see if it jolts them to wake them up, this is how you would do it without harming them. And then if they don't respond to any of the ways that you're trying to wake them up, you're going to do the sternum rub, which is taking the top of your knuckles and then raking them across the breastbone like this. If you did it to yourself right now pretty hard, you can feel that that's really uncomfortable. So if someone's not responding to that, they're completely unresponsive. If they are going to wake up from it, it's enough pain for them to say, hey, you know what? I was just sleeping, and they'll knock your hand off. So the sternum rub is how you're going to want to proceed to see if you need to go into overdose procedure. If they don't respond to that sternum rub, you're going to go ahead and call 911. And the next slide is the steps that you need to take when it comes to responding to an opioid overdose. So you've seen this person, you know that they're overdosing. The first thing you're going to do is call 911. You're going to let them know where you are and that someone has stopped breathing. If you have multiple people in the room, of course, someone calls 911 and handles that, and the other person starts rescue breathing. I do have a lot of people telling me right now that their facility will not let them rescue breathe because of the pandemic, and we totally understand that. It's per your policy and procedures. So if you are not allowed to rescue breathe, just take out steps 2 and 5. If someone is dying from an opioid overdose anyways, and it's just an opioid overdose, the Narcan is what's going to save them anyways versus the rescue breathing. And that's because Narcan is what's going to take that opioid off the receptor in the brain. So if you need to skip 2 and 5, that's totally fine. So you want to just make sure that after you administer either 1 or 2 doses, or if you have more before the ambulance gets there, that you can continue to administer Narcan, wait maybe a minute in between each dose is administered, just to see if this person wakes up. If they wake up, they are not going to be feeling well. Like I said, you're giving them something that makes them go into immediate withdrawal, so they don't feel well. So you want to let them know that you use Narcan and that they are not going to feel well, and it wears off in 30 to 90 minutes and they could overdose again. So that's another reason why having more supply of naloxone is necessary, because they could OD again before the ambulance actually gets there, and then you could just give them more Narcan to wake them up, and hopefully by then emergency medical services will be with them. And then you could stay with the person, or you should stay with the person until EMS arrives. So if you were to rescue breathe, this is just to show you if you are able to, if your policies and procedures allow you to, this is how you would check. So you look in the mouth to make sure nothing's blocking the person's airway. If something is blocking, go ahead and let the paramedic know if it's any further than the middle to the back of the throat. If it's anywhere near the top, you can hook and swoop, but any further than that, let the professionals take care of that because you don't want to lodge it further into their throat and have them choke. Put your cheek or your hand over their nose or mouth to see if you can feel breathing. If maybe see if their chest is rising and falling. If you notice that they are not breathing, you're going to put them on their back, tip the head back and place the hand under the person's neck to help you tilt it. With the other hand, pinch their nose, make a seal over their mouth, and then you're going to rescue breathe. You don't want to be spending 5 minutes sitting here rescue breathing. The Narcan's what's going to wake them up, like I said. So just make sure if you're rescue breathing, maybe take 3 breaths before each administration, and then you can take a step back for yourself. And if they're not responding, go ahead, rescue breathe, give them the next dose of Narcan, then keep moving on. So deploying the nasal spray kit, when you get a kit, if you do have to respond to an overdose, this is what it would look like. Each kit comes with 2 of those doses, like I said. So you'll peel back the package to remove the device. You will not press the plunger until you're ready to administer the dose. So you're going to place the tip of the nozzle in either nostril, does not matter which one. And then you're going to make sure that the top of your fingers touch the bottom of the patient's nose, like in the left picture. And then you're going to go ahead and go to the next one, Karen. Press the plunger firmly to release the dose into the patient's nose. So that's what it would look like if you were to deploy a nasal spray kit into someone's nose to rescue them from an opioid overdose. Next slide. So this is the Good Samaritan law. The reason why we talk about this was passed along with the Naloxone access bill. And that's because a lot of people were not calling 911 and they were not reporting people passing away or their friends or family members passing away because maybe they themselves had, a warrant out for their arrest, or maybe they were worried that the person that they were rescuing has a warrant out for their arrest or felony or misdemeanor priors, things like that, that they were worried because, us as a New Path, we're here, we advocate for therapeutic rather than punitive drug policies. So, people are worried. They're worried that they might go back to jail or that they might get arrested. So the Good Samaritan law was passed so that the person that you are rescuing, as well as yourself, are free from arrest or incarceration. So even in a school setting, even if a child had something on them, if they had possession, all of that stuff is not supposed to be talked about. They're not supposed to ask you any questions if police arrive with the ambulance, because this person is almost passing away and someone has called 911 and someone has become a first responder to save someone from an opioid overdose. In good faith, you are trying to save someone's life, and this person is free from arrest or incarceration. So if any flat comes through while you're going through this process, the 911 Good Sam law protects you and the person you're rescuing. If you need to leave a person alone for any period of time, this is the recovery position, which is on their side, like the diagram number 4. You're going to place the bottom arm under the head, top leg crossed over the body, and the knee should be bent for stability. So this is if you have to run into the next room to go get the Narcan, if this is at a school and they have to run to the nurses or admin office to go get Narcan and nobody can stay with them, and it's in a hall that no one's in and they're not in a classroom, this is the position you want to leave them in, whether it's for 1 minute or 5 minutes, hopefully not that long, but if you have to leave a person for alone for any period of time, this is the position you need to leave them in. When the person comes to and they do wake up from the opioid overdose, you want to explain to them what happened and that we've administered Narcan on them and that they've overdosed. They may be in withdrawal and that you understand that they don't feel well, but they are in withdrawal from the naloxone, and you want to make sure that you stay with them and monitor their breathing until emergency medical services arrives. You want to let them know that if they don't know already, Narcan wears off in 30 to 90 minutes, maybe more so 20 to 40, especially with things like fentanyl, or if they're using lots of an opioid, that the opioid's still in their body. And if they end up using more, that's just more drugs waiting to hit the receptors as soon as that Narcan wears off so they can OD again. So like I said, OD can come back as soon as the naloxone wears off if they use again too soon. If paramedics are not coming, the person should visit a doctor as soon as possible. And that's because they could have vomited, they could choke later, or they could have fluid in their lungs and get pneumonia. They could have hit their head and gotten a concussion. You don't know what happened to a person before they overdosed. So if you did not witness it, that's just to make sure that they get the proper care to address anything else that might have happened other than the overdose. What not to do in case of an overdose overdose. These are the horror stories you usually hear. These are all actual statements people have given me to tell me that this is what they did when someone was overdosing. I understand it's a frantic situation, but because if you do take these trainings, you do get Narcan, you won't need to have to do any of these things and, in worry that you need to shock a person into waking up. So don't leave the person alone. They could stop breathing. Don't put them in a bath. They could drown. Don't induce vomiting. They could choke. Don't give them something to drink. They could throw up. Don't put ice down their pants. It will cool the core body temperature and slow down the breathing even more. It won't do any more harm to them, it could do more harm to them rather than something like a sternum rub, because you can cause pain and cause long-term damage. Don't inject them with anything but Narcan. It won't do any more than a sternum rub causing pain, and it can waste time or make things worse. So for example, somebody gave someone a salt injection in like 2016, and that person went into cardiac arrest and passed away from their cardiac arrest versus their opioid overdose. Registration form, these will go over if you do schedule a training with us. So we'll go over that another time if you do come back to us or Karen and at NAMI to schedule these trainings. Next slide. If you use your Narcan, there is no punishment. You get a new dose of Narcan. We like to know if it is used and lives were saved, because it helps us get more free Narcan to give out more free Narcan. And just to let you know, Narcan's available at the pharmacy without an outside prescription, because pharmacists can prescribe for the Narcan as well, but they don't give it out for free. Not many insurances cover it, and it goes anywhere from $150 to $850. So just get it through NAMI or a new path and we can give it to you for free. Contact information. Here is my contact information. We'll leave that on for a second. I know that this is all on the LiveWell website as well. And then the QR code, Karen will bring back up right now. So if you wanted to get your phones out and scan that QR code, that is very helpful for these presentations. And like Karen said, it's super important. I, as a mother that has 2 kids in high school, and I know that their friends or they have friends of friends that are overdosing in class, in the bathrooms, after school, at their after school programs. It is very, very important to start getting this into the schools, into admin's hands, into nurses' hands, and to make sure that we're protecting our children while they're at school. So even if it wasn't at school, though, we encourage everybody to take the training and hand our information to anyone who would benefit from this. So please don't hesitate to share mine or Karen's information.
Thank you so much, April. So much great information.
That I don't see any questions in the chat. But again, people feel free to put questions. We have about 2 more minutes. If you have a question, please use the Feedloop platform for questions. I just want to bring your attention, make sure you go to the communication hub. There'll be some additional resources in there. There's a STCOE page with resources that will link you to a naloxone toolkit that will help you out if you're in a school setting and want to get naloxone. The information that you just received from Karen and April will be there, as well as the Department of Health Services will be in that toolkit, and also the LiveWell Tools for Schools, which is a searchable database. If you need assistance with mental health issues or ATOD issues, or really anything related to schools, and you want presentations or you need referral sources, any resources that you need, the Tools for Schools is now a searchable database. You can search by location, you can search by keyword. It really is a fabulous resource. So I would encourage you all to go to the Connection Hub and look for those resources, both the STCOE page and also the LiveWell Tools for Schools. I still do not see anything in the chat as far as questions. Karen, you want to close us?
I actually see a hand raised.
Oh, I cannot see anybody
from Martha. Now let me see if this is going to work, Martha. It says allow to talk, so I'm going to try this. So actually, I see Martha. There we go. You are actually able to talk to us, and it's Dr. Acosta. Thank you so much. I don't know if you are able to ask your question.
Oh no.
We can't hear you.
Yeah.
Darn, I thought I was being so smart. So maybe not.
Well, that was smart. It just didn't work.
After a year and a half of doing Zoom and these
Yeah, I know.
webinars,
Well,
you
this is
think
a
we
little
all
different.
have
We
it
got-
down.
We got two different platforms going, so they may not work. So we are right at 3:30. We should probably close. Thank you very much, Karen. Thank you very much, April. Great resources for schools and community members out there. Let's see, Chad is disabled. That was Martha. Yeah, she just said Chad is disabled and can't. And a lot of great presentations in here, though. Just several comments thanking you and what wonderful information and great presentations. So thank you both very much. For the rest of you, wait, can you show the slide again on the position to leave the person on? Ooh, I think that might take a little longer than we have, but people are going to get copies of the slides, I believe.
Show which slide? Sorry, let me see.
Yeah. On the other side, right? So, but I think you're going to get all slides from all the presentations, at least through the school summit. You'll be receiving the slides at a later date. And this is also being recorded. You'll get access to the recording. So with that, we probably need to close out. So sorry, we don't have time to get back there, but you'll have access to everything within 30 days, I believe is what Liv is saying. So thanks, Karen. Thanks, April. Thank you all for being here. Enjoy the rest of your afternoon.
Yeah, thank you, everyone. Bye-bye
Thanks,
now.
everyone. Bye.